Well, Dr John Puntis joins me now, Co-Chair of the Keep Our NHS Public campaign and a retired NHS paediatrician. John, very good evening and thanks for joining us. Now, it seems to me that Wes Streeting is being very pragmatic in seeing that there is a crisis in waiting lists. I think we can all agree that there is. And so, well, one way that we can bring waiting lists down more quickly is to use spare capacity in the private sector. Now, you obviously are running a campaign to keep the NHS in the public sector. Totally understand that. But in these circumstances, using some private sector facilities surely has to be supported.
Well, I think there's all sorts of problems with that approach. I mean, first of all, I don't think there is spare capacity in the private sector, and unless public funding goes into the private sector to enable it to increase capacity. And I think we want evidence-based, not class-based politics here. You know, we want evidence-based policy. So I think Wes Streeting would have to demonstrate that there is spare capacity being unused. And, you know, the health think tanks do not advocate this kind of approach as a solution to the problems of the NHS. The NHS and the private sector share a single staff pool. If you want an anaesthetist and a surgeon to do extra work in the private sector, they are then not doing it in the NHS. All the staff that the private sector has come from the NHS in the sense they were trained by the NHS. And developing services in the private sector then takes staff away from the NHS and has a negative effect. And we've seen that very clearly with the general outsourcing of ophthalmology, cataract surgery to the private sector. So I think the basic premise is wrong. And I think if Wes Streeting really believes it, he needs to come up with the evidence.
Well, let's assume that, I mean, I doubt whether he's just said this off the top of his head. Let's assume that there is spare capacity of some description in some areas of the NHS in England and Wales. If that is the case, do you not think that, at least in the short term, that is one way of reducing waiting lists?
Well, I don't accept the premise. I think if he could come up with the evidence that there was spare capacity, I would agree. But I don't think he can do. And we have to bear in mind that the private sector is small, about 8,000 beds. Average size of the hospital is 45. They don't have good governance arrangements. They don't have multidisciplinary teams. They don't have ITU. They have a poor safety record.
But they have a lot of facilities which can be used. Say they have MRI machines, for example, which could be used to treat NHS patients, which actually they are already to an extent. But let's say that they've got spare capacity there. I cannot see any harm at all to the NHS of using those machines for NHS patients to cut the waiting lists.
I agree with that. I mean, I think if they've got unused capacity in terms of MRI, which are used for diagnosis rather than treatment, then fine, the NHS could make use of those. But I think I would still come back to saying that there are major problems with the private sector and the way it operates, its business model. We saw that with Iain Patterson, the breast surgeon in Birmingham, the private sector washing their hands.
Please, don't come up with things like that when I could easily respond to you with huge numbers of NHS scandals where things have gone very wrong. Things go wrong in the private sector and the public sector.
Yes, this is not about whether things go wrong in the NHS. It's about the business model of the private sector. And by the way, the private sector transfers almost 7,000 patients a year back to the NHS when problems have occurred in the private sector. But my basic point is that there is not spare capacity. If you do more in the private sector, you take staff away from the NHS. That's well known, and that undermines NHS capacity. So that's the basic flaw in the argument. And if I'm wrong, let's see the evidence. Let's see a business case which shows taxpayers would benefit. We know that when we've put money into the private sector, for example, during COVID, given $2 billion a year to keep them afloat. They did very little work in return for and they claimed $72 million in furlough payments. That's
a very odd way of putting it. It wasn't giving them $2 billion to keep them afloat, as you put it. Now, you're right, in the end, I don't think they did use probably enough of it, but that was the reason. It wasn't to keep them afloat.
Well, no, I think that's highly arguable. I mean, if it was really to make them do work for the NHS. There should have been a mechanism for ensuring that they did do work for the NHS. I think they were at risk in terms of business sustainability from the pandemic, and I think that's what motivated government to put the money in. But we can disagree about that. But I think we can agree that in the event they didn't do very much work for the NHS, so this was poor use of taxpayers' money. And I would suggest that the same will be true if Wes Streeting wants to put more money into the private sector. I think that's a move towards a two-tier system, and it would be money that's not well
It's
spent.
not a case of wanting to put more money in the private sector. It's using the private sector to reduce waiting lists, which I would have thought anyone with an ounce of compassion would think was a great idea.
Well, except that it doesn't work like that. They do not have spare capacity sitting.
You say that they don't. You provided me with no evidence to say that they don't, beyond the sort of bigotry of anti-private sector healthcare.
No, it's not. I think that's very unfair. It's not bigotry. It's a staffing issue. They do not have staff except those that they take from the NHS.
Well, let's assume that they do, because most private sector hospitals will have permanent staff, and if any of those permanent staff have spare capacity, why shouldn't they be used for NHS treatments?
Well, most of their doctors, the vast majority of the doctors that they have, the surgeons and the anaesthetists, for example, work in the NHS.
Yeah, so you're right.
And
some
then they
do,
either
some
work
don't.
spare time in the private sector, or they have a job plan, which means they reduce their hours in the NHS so that they can go and work in the private sector. So the whole concept of spare capacity
I think you're part of the problem.
Mistaken.
I think you're part of the problem, because in any other country, in Europe, for example, the private sector and the public sector operate quite happily alongside each other. There isn't this public sector good, private sector bad attitude that you exemplify here. People work together, and that's what should happen in this country.
Well, a recent analysis from the Lancet has shown that outcomes generally in privatised systems are worse than in
I'm not
public
suggesting we
systems.
should have a privatised system. I'm saying that the public sector and the private sector in virtually every other country, not just in Europe, but around the world, work together perfectly happy for the good of their patients. And yet here we have people like you who think the private sector is innately evil.
Well, I haven't said it's evil. I'm saying it's a poor
is.
business model. It's not good value for money. Outcomes for patients are not so good. Patients are exposed to increased risk. So therefore, the question is, what, as a rational policymaker, would you want to do? Would it be to spend money in the private sector, or would it be to restore
At the moment,
the NHS?
if I was Secretary of State for Health, I would think the best thing to do would be to utilise any spare capacity that there was to reduce waiting lists and to help people out of the sometimes chronic pain that they're in. That's what I would do, and I think that's the logical way forward. Obviously, you disagree, but there we are. Thank you very much indeed. That's Dr John Puntis from the Keep Our NHS Public campaign.